Can you name an organ that aids in the digestion of food? Welcome to the Inspired Vitality Show. I'm Catherine. Today, I honor National Pancreatic Cancer Awareness Month and World Pancreatic Cancer Day, which is observed on the third Thursday of November. In this video, I'm going to give you the basics of pancreatic cancer, and I'm highlighting the impressive work of the Pancreatic Cancer Action Network. First, an overview of this vital organ and why pancreatic cancer has the highest mortality rate of all major cancers. Pancreatic cancer begins in the tissue of the pancreas, an organ lying behind the lower part of the stomach. It's about 6 inches long and it looks something like a flat pear lying on its side. The role of the pancreas is to release enzymes that aid digestion and absorption of nutrients. It also releases hormones that help to process sugar in the foods you eat. The most common type of cancer that forms in the pancreas begins in the cells that line the ducts that carry digestive enzymes out of the pancreas, known as Pancreatic Exocrine Cancer, and it is usually found at an advanced stage. Less frequently, cancer can form in the hormone-producing cells or the neuroendocrine cells of the pancreas. These types of neuroendocrine cancers tend to have a better prognosis. Just last week, I released a video about neuroendocrine cancer, which included some information about pancreatic neuroendocrine cancer. So I'm going to link to that in the video description. Some factors that may increase your risk of pancreatic cancer include smoking, diabetes, chronic inflammation of the pancreas, also known as pancreatitis, family history of pancreatic cancer, and people of an older age, as most people are diagnosed after the age of 50. There are often no symptoms of pancreatic cancer in the early stages, when it's most curable. When the symptoms do present, they can be nonspecific, and it may have spread to other organs, so it is often detected late and has a poor prognosis. Some of the late-stage signs and symptoms of pancreatic cancer may include abdominal pain that radiates to your back, loss of appetite, or unintended weight loss, a new diagnosis of diabetes or existing diabetes that's becoming more difficult to control, blood clots, and fatigue. According to the American Cancer Society, pancreatic cancer accounts for about 3% of all cancers in the United States and about 7% of all cancer deaths. Treatment may include surgically removing the pancreas, radiation, and chemotherapy. Now, if you've watched some of my other videos, you know I love providing resources and sharing information about organizations that are doing good work. The Pancreatic Cancer Action Network, or PanCAN, is encouraging pancreatic cancer patients and families to talk about the importance of genetic and biomarker testing. If you have a first-degree relative that was diagnosed with pancreatic cancer, you may have an increased risk of developing the disease, and PanCAN recommends that you consider genetic testing for inherited mutations. If the genetic testing reveals a risk, it does not mean that you will get the disease, but rather you then have the information to talk with a doctor about ongoing monitoring. If you have a loved one that is facing a diagnostic pancreatic biopsy or pancreatic surgery, or you yourself is in that situation, you may want to consider biomarker testing. During a biopsy or surgery, tissue from the tumor is taken to be analyzed and perform biomarker testing. It tells you about the biology of the tumor and can help patients find treatment options and make decisions. This is going to help improve survival. It is recommended that pancreatic cancer patients get biomarker testing and genetic testing as early as possible, but it can happen at any time. PanCAN offers patient services to learn more about these tests, as well as a wide variety of education and support for patients and caregivers. One of their offerings is a free educational packet that includes 2 in-depth, easy-to-understand booklets and resources and helpful tips about getting organized after a diagnosis, such as questions to ask and more. PanCAN also offers information about living with pancreatic cancer and addresses pancreatic insufficiency, or the inability of the pancreas to make or secrete the enzymes needed for digestion. A very common problem for pancreatic cancer patients is digestive issues, resulting from removal of part of the pancreas and leading to having an insufficient amount of pancreatic enzymes. Patients may not be able to digest or absorb the fat from the food that they eat. When undigested fat remains in the stool, it causes diarrhea and poor nutrition. Patients may also experience abdominal cramping, bloating, and excessive gas production. PanCAN helps patients make the healthiest choices possible to maintain the best quality of life. Of course, I'm going to link to their website and resources in the video description. I hope this video has given you insight into the important role of the pancreas and where to go for help if you or a loved one is in need of pancreatic cancer resources. Leave me a comment if this video has been helpful. See you soon.